everybody. I'm Angela Hart, and welcome to the Heart of New York show. We have a panel discussion today that is going to deal with legislation concerning special needs, seniors, and passenger safety. How do all these things tie together? We're going to ask certain questions and see if we can get some answers going here. One question is, should nursing homes install 24-hour camera and audio devices to prevent nursing home abuse? This is a question I have. The panel didn't know that I was going to address this question, but we are going to discuss it because I feel strongly about it. Next question, should homeowners be given tax credits when they install disability devices and access ramps for people with disabilities and seniors? Should drivers over 75 years old be required to pass cognition and reflex exams? I feel strongly about that. We're going to talk about that. And should sleep-deprived drivers be charged with a DUI when they cause accidents? These are some hot topics. They're controversial, and I know that you'll find them interesting when our distinguished panel discusses these topics. I'd like to introduce you first to my co-host. His name is Eli Goldbaum. Eli is president and CEO of FHS Consultants and other senior care financial services companies. He's been active in the healthcare industry since 1987. He served as a controller and a facilities management agent for a group of nursing homes. And he's an industry consultant for accounts receivable reduction services. He's also a much sought-after lecturer in the healthcare field. He's lectured at the New York State Bar Association, the healthcare section, and at the American College of Healthcare Administrators. He's an influential figure in the healthcare field, and his advice and input are regularly sought after by professionals. Thanks, Eli.
Thank you for having me back, Angela. It's a pleasure to co-host the show once again, and looking forward to a great discussion.
Yes, we're definitely looking forward to a great discussion. And on his left is Al Murray. Al is a partner with United Sleep Diagnostics Company. Welcome, Al.
Thank you, Angela. It's a pleasure to be here today.
We're glad that you could join us. And on my right is Caryn Isaacs. She's a patient advocate with Get Health Help. And she's also co-chair of the Senior Umbrella Network Advocacy Committee. Welcome, Caryn.
Thank you for the opportunity, Angela.
We're looking forward to hearing what you have to inform the viewers about with respect to senior care and health care and a special bill that we're going to be speaking about. And on my right is Anthony Lemma. Welcome, Anthony. He's the Director of Community Relations for Assemblyman David Wepring. And he's also the Government Relations Chairperson for Senior Umbrella Network of Brooklyn. Welcome.
Thank you, Angela. It's a real pleasure being here. Thank you for the invitation.
It's a pleasure. What a distinguished panel we have here. I thought it would be helpful to first talk about Senior Umbrella Network, because this organization is considering expanding into Staten Island. I'll ask Anthony to please tell us a little bit about Senior Umbrella Network, because this is an organization that's considering moving here to Staten Island and opening a branch.
Well, they are looking forward to going into Staten Island. Senior Umbrella Network of Brooklyn is a senior advocacy group that runs programs for seniors. They have a fall prevention program, which has been very successful for the past 2 years. We also get into legislative events and affairs and look to advocate for bills to be passed by the State Assembly. And basically, we're out there and we want to be an advocate for seniors in any type of problems that they have. We are promoting senior centers. We support the continuance of senior centers and really like to expand, so that's what we're hoping to do in Staten Island.
Great. And Caryn, did you want to share a little bit about the other organization that we spoke about?
Yes, so the Sun Advocacy Committee is a multi-chapter organization that is comprised of members from all of the Sun's senior umbrella networks. There are chapters in Brooklyn, Queens, Nassau, and Suffolk. And each chapter sends representatives to the committee whose primary focus is to educate the public and to encourage professionals to learn the issues that affect seniors.
That's great. In fact, I'm going to personally help Sun in getting the word out there that they're going to be opening in Staten Island, and we're going to approach a lot of healthcare providers that are in the senior care industry to join the organization. Ellie, you've been a member for how many years?
We've been involved with it probably about 4 or 5 years at this
least-
point, yeah.
And so it's going to be a really exciting time for Staten Islanders. I think I'm going to approach some of the hospital administrators, and who else should I approach here on Staten Island that would benefit from the organization, in your opinion, Caryn?
Well, there was an organization that represented brought together the professionals in the senior industry that was really run by one particular person who had to step aside, and when she did, it left a real void there. And so Sun has been the place that people from Manhattan and from Staten Island have gravitated to, probably because we have wonderful speakers. We have some of the most active and enthusiastic members, networking opportunities and educational programs developed by our founder and chairperson, Vicki Elner, who I know you had as a guest. Yes. And so that is the reason that as more people became active and actually came on the board of Sun that the decision was made to branch out here and have a separate chapter.
I can't wait, and so Staten Islanders, we're knocking on your door. So Anthony, tell us about this bill that you're proposing gets passed, and I don't even know what a bill really is legally, and I'm sure that some viewers don't. Can you first explain the legal aspect to this?
Well, what this is we're proposing legislation in the New York State Assembly, which is under Bill number 5333, which is being sponsored by Assemblyman David Weprin. And in the state Senate is called S2829, which is being sponsored by Senator Kenneth Parker. Basically, what this is going to do, it's going to allow a tax credit to be equal to 30% with a maximum of $5,000 of the cost of expenditures for retrofitting a home for disabled access. Now, everyone knows that keeping seniors at home is the most effective way about going about things because, number one, it's cheaper. It's going to cost the state a lot less money to have that senior at home than putting them in a nursing home. And secondly, it gives people the incentive to make their house user-friendly in cases like this, meaning a no-step entrance or entrance allowing access to the residence. So I myself have a mother-in-law who's 94 years old who's having a very tough time getting up and down stairs. And interior passage doors providing at least 32 inches wide opening, which is important. Reinforcements in bathroom walls, allowing installation of grab bars around the toilet, tub, shower. And this is very important, getting back to Sunbee's program of fall prevention. Because if a senior falls and breaks a hip, you know we got big trouble then. And that's at a nursing home, that's rehab, that's a lot of money. And most seniors, unfortunately, if they're over a certain age, are not going to recover from a fall like that. So also this bill would also cover things like light switches and outlets placed in locations accessible to disabled persons. Now, this, like I said, disabled persons, it could be someone who's a lot younger, who's got problems. The tax bill would cover all of that. So what we would need to do would be to pass it in the Assembly. That was already done last year. The bill passed the Assembly, but unfortunately, it was not passed in the state Senate, and that's where we need to go.
And how does one, if one decides that they'd like to see, this is a law, would we call this a law?
This would be, yeah, it would be a tax. It would be part of the tax law.
code.
Yeah, tax code.
So
Yeah.
I'm going to digress for a moment. And so I have this idea that I feel that nursing homes should be installing cameras with audio devices almost throughout the entire premises, except to consider for privacy reasons in the bathroom or whatever. But I would like to know that by the time I'm that age, where I might be one of those residents, that there is a 24-hour guard watching by camera. And so I have this thought in my mind to get a bill passed or a law, and I didn't know where to start with it, but when I realized you were coming on the show, I was going to ask you about that and see if any of the viewers are in agreement with this. And so you can write to Angela Hart at providersadvocate.com and share your thoughts with me. Some thoughts.
Well, the thought I would have on that is anyone that has an idea for legislation should do that, and that's what the elected officials are here for. Assemblyman Weprin has an open door policy at all times to anyone to come in to discuss legislation with him. There are many members of the New York State Assembly that are the same way. I would recommend going to your elected official and asking for a meeting and just bringing it up and saying, you know, what do you think? So many bills start out that way, where you'll have people come in and say, you know, we really have this idea, and we think, I can just give you an example. Right now, we proposed a bill, it's going to be in the New York City Council, that the city air condition every classroom in the city of New York. And this came about by parents who feel that their kids should not be sitting in 95-degree classrooms and sweating like that. It's a health hazard and everything else. So legislation is actually being presented that come to pass. So that's the way you get it
That's how
going.
you said-
Yeah.
Could I ask a question?
Sure.
The tax credit that you're referring to, is that a state tax credit, federal tax credit, or both?
That would be a state tax
Interesting.
credit.
And maybe if I could interject that, George Failing, who was the person who first brought this,
Yes.
the idea of having the tax credits to Anthony.
Right.
And
Tell the viewers who George Failing is, because we're airing this in Staten Island. I didn't have the pleasure of meeting him.
yeah.
He was a
And
great
George
guy.
Failing was very well known in Staten Island, and I was lucky enough to represent him as social network marketing representative for him for many years. And I like to read it because he has such a long resume that you can't think of which things to pick out. But just on the island, he was awarded the Lewis R. Miller Leadership Award from the Staten Island Chamber of Commerce. That's an award given to those who show leadership and mentoring. And he was awarded the New Yorker of the Week right here at Time Warner Cable. And he was awarded the Richmond Senior Services Center for Independent Living Award. He was a member of the Staten Island Interagency Council for the Aging. He provided services to the New York City Human Rights Commission and the Health and Business Alliance, and he was one of the founding members of the Staten Island Bucks organization, which is well known here.
Yes, yes it is.
And one of the things that we were doing was going to the legislators to talk, and to businesses, to talk about a federal tax credit that allows businesses to make alterations to improve accessibility in their business. So this would be, this is a natural progression to allow homeowners as well to do it.
Why would the state not want to approve this? Financial reasons?
Well, that's a good question. I mean, you look at a bill like this and you say to yourself, how could you be against it? That's the way I look at it. This is something that I feel we could definitely reach across the aisle and have the Republicans in the Senate, come on board with this, and especially the IDC, which is the Independent Democratic Conference, which are the Democrats led by Senator Klein, who caucus with the Republicans. To me, this is a no-brainer, and this is something that should be a very easy bill to come across and to agree with. One of the problems I think we might have this year is because of the federal budget. We don't know what we're getting from Washington, D.C., and I don't want to start about that. That's a whole other discussion. So I'm hoping for the best. I definitely am.
Well, especially when it comes to helping people accommodate seniors and people with special needs. I think there's no two more vulnerable populations.
That's very true. I mean, seniors are your most vulnerable, and I have to say that the congressional delegation here in the city does have a very good record on getting the things needed for seniors here.
So what's the next step?
The next step would be, right now, I feel, getting the word out, going to certain senators, and whoever your state senator is, write letters, make phone calls, send emails, and tell them that you're in support of the Assembly bill, which is 5333, sponsored by Assemblyman Weprin, and the Senate Bill 2829 in the Senate that's sponsored by Senator Paul.
Now, we actually spoke about this several times on the show, in the senior population going into the MLTC world, where the MLTCs are going to be covering the care. This governor's person up at the state, I don't know exactly his title, Jason Helgerson, who's overseeing the commission, he's made it very clear that they're looking to get patients back into the community as opposed to keeping them in the nursing homes. So this would actually feed right into
No, I
the
get
need
that,
of-
absolutely, no question about it. And I think we all feel very strongly, like I said before, that the place for a senior citizen is in their home as long as they can possibly be in their home. Like I said, I have a mother-in-law, God bless her, who's 94 years old, and she's still home, and she's doing, pretty good there, and we're going to try and keep her there as long as we possibly can.
Thank
Can I
you.
say, the Advocacy Committee, our role will be to reach out to businesses and professionals and company owners to ask them to join the Sun organizations in supporting this bill by going to the sunadvocacy.org website. And we have a sample letter there that you can use to just plug in your organization's letterhead. If you would let your members and your employees know about this, we can really get thousands and thousands of people involved, and that's what's needed to pass a bill.
Excellent. And so I raised the question about having cameras and audio devices installed in nursing homes to prevent abuse issues. And we have really some of the finest nursing homes in New York, in my opinion. However, there are exceptions. And so, Eli Goldbaum, since you're a person and you're in the industry, I'd love to hear your initial gut reaction to this. Please speak freely.
As we do assist a lot of nursing homes and help them out, so I have a pretty good feel for what goes on in nursing homes. There's no question about it. The toughest challenge of a nursing home is to find the proper care givers, to find the aides. It's not so simple to find proper care at the facilities, and I do believe there are definitely times that you do have people that probably are not the best caregivers, certainly at different facilities. One of the challenges that we face quite often, we advocate for patients to go in. People will call us for a recommendation to a facility, or we help a lot of people get aides in the house as well, and you have that quite often with people actually have those nanny cams in the house. And I think without a question, there's no. I would love to have it if God forbid it was my parent or whatnot. I definitely would want to have that ability to have a camera. So yes, I would join you in that.
So you just, okay, so Ellie, so you're going on TV saying that if I get this initiated to approach an assembly person or whoever's required that you instructed before, that we would like to see a regulation that requires these nanny cams be in almost every place in the nursing home. You might agree with me. That would be wonderful.
I think it's wonderful, and I'm not going to say that I would put my name on it if that's what you're asking. But
I want it named after myself.
I
That's
will
how
say,
strongly I feel about this.
Angela, you did say that you want it to happen before you go into a nursing home,
Yes.
which is many, many years down the line.
God willing.
So
God willing. We
that's
don't know what
correct.
happens tomorrow, Ellie.
That is
It's not
correct.
promised to us.
That's
Tomorrow's not
correct.
promised
Well,
to us.
Angela,
good.
can I say that, this is actually what George was working on when which is, so a new law is really not needed. The expansion of use, the law gets passed and then people have to start using it. Either they have to break the law or they have to take advantage of that law to make something good happen. And so the federal tax credit for alterations to improve accessibility would probably cover this kind of an issue. We were going into nursing homes, assisted living facilities, asking for anything that would make the residents safer and more comfortable. Things like ramps and elevators, but also doorways that would open automatically. You see someone coming in a wheelchair and they get up to the bathroom door, and it's a big bathroom door, but they can't reach it, they can't push it. So we were looking for to have the doors open automatically. It's the same kind of mechanism as an elevator. It's the same kind of price as the elevator. So I think that those kinds of issues, any kind of monitoring system would probably be covered. I mean, it's broad. The bill language that we have in this new bill, it takes into account anything that would be considered useful to and helping to allow that person to remain in their home or to be able to use the facility without having to be considered a nursing home patient, possibly in an assisted living, or even a bed-bound person if they are in a nursing home, and they may be able to be much more
I would like to say one thing. You know, thinking about the regulations, and I think that one thing the viewers do have to understand, the nursing home industry is probably from the most regulated industries out there.
Yeah.
And it's not often that you do have issues like this where a camera would pick something up. And I think with tort reform and other issues of insurance, where anyone who would have a camera like this on them, that some patient could decide arbitrarily that, you know, something happened, and then you would have all these additional insurance claims against the facilities. You have to understand, the industry is a very, very heavily regulated industry. You have a nursing home has a survey every year where the state and sometimes the federal government also comes in to check out the facility. They go patient by patient or speak to specific patients about the care and other issues. If there is an incident, the nursing home is required by law to go ahead and report that incident. So at this constantly, they're in-servicing their staff and whatnot. So I know that I wouldn't scare the viewers in thinking that this is something, it's not the 70s anymore, where you had those issues where there weren't really proper regulations, or maybe it weren't enough regulations. I think today the industry is very, very heavily regulated. I don't believe that you have that many cases. And I'm not saying it doesn't happen, but think about how often do you hear something like that on the news?
Okay, so we don't hear it that often on the news, but my problem is I'm at the nursing home almost every day visiting my mother-in-law, and it's a very well-run place. In fact, the nicest nursing home I've ever been to. And you hear some crazy accusations by the residents because they have dementia, and I always wonder, what if this one time it's true? So it doesn't have to reach the news. It could just be this one time it was true and somebody experienced something bizarre and violent. And I'd like to know for myself or for my mother-in-law that there's a camera to check it out, just like policemen now are starting to wear the camera. Why can't people who are taking care of the vulnerable have to be on camera? And I'm curious, you haven't shared anything yet. Al. Did you have a thought?
Yes, of course I do.
Share your
Nice of you to bring it my way.
Yes.
My thought is that we have to look at the nature of people. Ellie said you have to get care workers who are the right care workers, the qualified, the good care workers. So it comes down to human behavior.
Yeah.
If there's a camera, then I'm going to think twice. It's a disincentive.
That's
I
it.
won't be tempted that I see a $100 bill sticking out from the drawer or a wedding ring on the sill, windowsill. It's just a good thing. If you have nothing to be afraid of and nothing to hide, let it be.
Could I ask you a question? Would you
Yes.
take the job? If that's, you have to realize that that the facilities, I'm not here, you know, specifically taking a side, I'll just throwing the other side. The facilities have a very hard time, and I mentioned it sort of before, finding the proper staff. This is not necessarily staff that's the highest, you know, you're talking about a staff that potentially is making, I don't know, $15, $20 an hour, maybe $15, $20 an hour at the highs. And it's very, very difficult for them to find proper staff.
I don't want to hurt your recruitment efforts
you
here.
know what I'm saying?
But I've already agreed to and gone through an extensive background check. I'm in this field for a reason.
Right.
I'm a caregiver at heart. I want to do well. I want to do right. It makes my parents happy, makes my grandparents happy. I'm caring for others like them. And so, yeah, I have nothing to hide. I'm
So-
willing to take this job.
So I'll tell you why I'm saying what I'm saying. I just read a Reader's Digest story, and I think it's 2 months ago, if I remember correctly, about a nurse who actually took her own life after she administered the wrong medication to a child, and the child passed away shortly thereafter. I think it's in the March issue, if I remember correctly. To me, it was fascinating to read this. The way they wrote about her, she was a nurse for 20-some-odd years, giving amazing care. And then this error happened, and it was human error. Certainly it
She
sounded
might
like
have not
that.
gotten enough sleep for a couple
There
of
you go.
days.
We're going to get onto that topic next.
But I'm just saying, that this is the reason why I think you have such a tough time passing bills. I'm not here to I'm just playing devil's advocate. I'm not saying.
No,
I-
you're 100% right. That is one of the reasons why.
But Ellie, what did that have to do with, I'm not making the connection.
But my point is that you have someone who agreed to become a nurse, went through the years of training, did the right thing, and just heard from a doctor, and potentially if several years ago, we have, for instance, today you have EMR, which is electronic medical record, and other things that they do require things to be input into a computer. It seems like this error was a human error in the sense that the doctor gave over the medication that verbally, and the nurse obviously understood it incorrectly. But my point is that if the flip side, and again, I'm not saying that I don't agree with or disagree with the camera issue, but the flip side to that is it's going to be very difficult to get the proper staffing. It's going to be difficult, and again, I understand we're taking care of human beings. Don't get me wrong, I get it.
You mean you
But-
think the camera is going to be a deterrent from getting good staffing? Is that what you're saying?
Absolutely, I thought
Can-
that a
can I-
question.
I'd like to share a story that just happened this week in a hospital. And I usually take a picture of my client, and I come in to do an assessment on behalf of the family or on behalf of the client requesting it. And I take a picture so that I have documentation really for myself and for the family as to what's going on and the condition of the patient. I came in to meet this patient, and the family was going to meet me there. But I've never had a patient ask me to keep things private. They always say, please tell as many people as you possibly can. Find out anything you can to help me. When I came in with the camera and I took a nice close shot of him, the nurse and the social worker were immediately at my sides. We have to confiscate your camera. You are not allowed to take any photos. You took a picture in the hallway, and there might have been another patient in the background. And I said, well, I'll show you the picture that I took so that you can see that it's of the patient. And I usually have a healthcare proxy or a HIPAA form with me. And they freaked out. They said, we have to go and get the legal department.
Oh, my gosh.
And I said, please do, get the legal department. Well, they didn't get the legal department. But things that had happened to this particular man, the family was not aware that this person was being treated in this particular manner. He was tied to the chair. He was being fed by, and the record was now saying that he required to be fed. When we came in, we said, why don't you give him the spoon? And he was able to eat on his own. And this would have a dramatic impact on the discharge plan that he could have. So I think absolutely it would be great to have these cameras as an option for people to, I think somebody who objected personally, I say, I don't want it, that they might be able to opt out in some way, but I think most people would want to have that.
This is something that I couldn't speak on behalf of Assemblyman Wepper on what his position is because I don't know it. But again, request a meeting with your elected official and run into it and see. But like what you were saying before, you're going to have people that are going to be very against this. There's no way around it. You're going to have people that are going to be against it. And every type of bill, you're going to have somebody that's going to be against it. I can tell you there's a bill right now in the New York State Assembly for the Adoptee Bill of Rights. And the people who are adopted in this state have absolutely no rights at all. They can't get their birth records. They don't know who their mother and father was, especially in today's day and age where you look at it and you say to yourself, diabetes runs rampant in my family, heart disease. Well, if you're adopted, you can't get the records.
Exactly.
Now, you would think this has got to be something really easy. How could anybody be against this?
Yeah.
7 years trying to get this one bill passed. 7 years.
Okay, thank you. So Al brought up the topic about how mistakes can happen because people might be sleep deprived. And interestingly, The Washington Post recently published an article entitled "Sleep-Deprived Drivers Similar to Drunk Drivers." The AAA says that getting behind the wheel after 4 to 5 hours sleep is like a DUI. So those who sleep less than 4 hours actually risk 11.5% higher of getting into a crash. So there's some merit to this. So let's talk about this topic, Al.
Well, motor vehicle accidents, the safety on our highways. We all know that the number one cause is alcohol. But number two is drowsy driving. And it is proven that when you are sleep deprived, 4 hours, 5 hours, you will have less cognition, your reflexes, your judgment, your depth perception, when to brake. And even if you completely nod out for a moment at 60 miles an hour, that's a big swerve. And it's not only you. You could be taking out a family of 5, God forbid. So this applies to all modes of transportation, because we've heard horror stories about bus accidents, train accidents, and all kinds of accidents, not only in transportation, but in the work area of performance, whether it's 3 Mile Island or Exxon Valdez, and it's international, Chernobyl. You look at when these occurred, a lot of these occurred during the wee hours, when only maybe the bus driver is awake, everybody else is asleep on the way back from the casino, and all he has to do is nod a little bit, and very terrible consequences follow. Finally, we talked a little bit about the medical industry. It was known that in medical school, if you want to become a doctor, you're going to work long hours, and they used to do double shifts, and pilots who flew planes would often have to do a double flight. Well, now legislators are aware and have said within a 24-hour period, no one, not a policeman with a gun or the aforementioned professionals, can work more than 12 hours in that 24-hour period for the very reasons we just touched upon. You just won't perform at the same level, and you have lives in your hands, and you must be responsible for them. By the way, what's number 3 as far as catching up to alcohol and drowsy driving on the road?
Texting.
Oh,
yes.
yeah.
Rapidly catching up, which is a real problem as well.
Would you like to share with the viewers your understanding about the MTA, particular regulation they recently came out with for their employees?
Well, we could just have to look at our newspapers and our headlines over the last several years. Some of these rather devastating crashes and incidents have made it quite clear that it's very costly, both in lives and casualty, as well as financial property damage. It's better to prevent these things than to react and pay for them once they happen. They have stepped forward and said, we're going to allocate money and have our responsible bus drivers, train conductors, etc., screened and tested to make sure that they don't have a sleep disorder, and we must do our best to avoid even one more crash that could be prevented.
So what are they actually doing? Tell us more about it. What are they?
Right now, there is a medical algorithm that's being approved whereby just about everyone who is in a position working for the MTA as an employee will be visiting their health center, local community health center, and they will be asked a series of questions and screened, therefore. Do you have suspicious sleep deprivation? Do you fall asleep at the inappropriate time? How likely are you to fall asleep while you're watching television? Even if it was a game or a show you really wanted to see. How long can you read a book without nodding off, even if you were into that book? So if they see and determine that this is a potentially sleep-deprived person, they will be advised to be mandated to visit a medical professional who is board certified in sleep medicine. There is that specialty. And I know you'd probably start to think of a particular profile, but it could be an internist, a pulmonologist, a neurologist,
That's scary.
an otolaryngologist or ENT. Anyone could get board certified in sleep medicine, and I congratulate those that have.
Oh, I thought you meant
Yeah,
would one of
yeah,
those
they could be
professionals
falling
be
asleep.
working on us
Yeah.
while they're half asleep and they're
No,
doing
you
brain
must
surgery.
visit one of them, and their professional assessment, therefore, will dictate what comes next. A home sleep study, an in-lab sleep study, and there are many treatment options that could be outlined on the basis and diagnosis of that testing.
Al, can I ask you, I know that the MTA has mobile vans for drug testing when they, that they come around and do screenings without any notice, or they do screenings, if there is an incident, they bring in a mobile unit. Do you think that there's a place for something like that for the sleep
Deprivation?
issues? To see,
Well, I think
to see
it's
if the
all-
people are alert? How to
I think it's
determine if
already
they're
going
alert?
to work in the format that I understand it will be, where over time, X number per week, employees will be scheduled to visit their health center, go through the screening, and then it's pathway 1 or pathway 2. And if it's pathway 2, you will be seeing a sleep medicine professional, and that whole sequelae of events will take place. And so, if I want to keep my job and my livelihood, I'm going to do what I need to do, and then we all benefit because there'll be less of those devastating incidents.
So do you think that if a person is sleep deprived, is it it's an ongoing thing for them? It's someone that usually has it, like a sleep apnea problem? Or could it just be this one incident, I didn't get enough sleep last night?
It could be that nurse who made the medication error where it's just the one incident, or it could be something that Anthony mentioned, familial. Everybody's ravaged with diabetes. Well, sleep apnea
Right.
and that whole metabolic profile could be in effect. Obesity, diabetes, hypertension, all things that increase the likelihood that you'll have sleep apnea, and that it'll be a worse sleep apnea than someone who's healthy and has sleep apnea. And you might say, how could you be healthy and have sleep apnea? Anatomically speaking, when you put your head back on the pillow at night, you may be causing some sleep apnea, all right, where the tongue falls back, blocks your airway, your nose is congested. It's really an iceberg, and we're only looking at the tip of that iceberg, I assure you. And it's really something that we have to get a little bit, better grasp on, and improve the quality of life and the safety of our highways.
How's the testing done? How long does it take to get tested?
All right?
Pays for the testing.
All
Give
right.
you a whole list.
Thankfully, the insurance plans like Medicare and all the others realize how important this is. It's a diagnostic test, like getting an X-ray. They will pay for it. So you come to a place where you can have a overnight polysomnogram sleep study. There doesn't have to be only sleep apnea. There are many, many parasomnias. You've heard of them. Insomnia, narcolepsy, restless leg syndrome. I could go on and on.
I've heard of that. Why is that anything to do with not sleeping enough?
Well, it's called sleep disorder because there is an order to sleeping. You have to go into a wakeful state, and then a light sleep, and a deep sleep, and then REM sleep. It all happens in an order or sequence. And if something is taking you out of that natural progressive sequence, like the guy upstairs just turned his stereo on, or a train went by, or physiologically I'm choking and I can't breathe, I have apnea, loss of breathing, I have one choice or another: continue to suffer and pass away in my sleep, or my body has to thrust me out of this with a grunt, a snort, and thankfully that happens. But it's devastating to imagine someone going through this hundreds of times per hour during those 4, 5, 6, 7 hours that they've been in the bed.
But what's even more devastating is to think about the lives lost or damaged because someone hasn't gotten enough sleep and they've been irresponsible and gotten behind the wheel. When I was in my 20s, I got engaged, and that night I fell asleep at the wheel and I wasn't drinking. I think it was a bad omen because that marriage ended after a year and a half. But anyway.
You were blessed to survive that.
Yeah, and I always thought, what kind of idiot falls asleep at the wheel? That's what I used to think. Now, if I even feel, because I was sleeping with, I had one eye closed and then I took the other one, and I hear this from people. They were tired and they kept one eye closed and they let the other one close
Yeah.
for a while. And I got into an accident, and thank God I was okay. I hit the tree. I didn't hurt anybody else.
It's life getting in the way, because as a new parent, you've been up all night with your crying baby. Or as a medical student, you've been studying, cramming, or you've been assigned a different shift as a shift worker. I'm a day shift, now I have to work nights. And it throws off your normal clock, your circadian rhythm, and you are sleepier than you normally
And you're a
would be.
danger to society at that point. So I have a question for the panel, the other members of the panel. Should sleep-deprived drivers be charged with DUI if they cause an accident? What do you think, Anthony?
Once again,
What's your personal opinion? You're not speaking for the assembly. What's your personal opinion?
my personal opinion on that is no. I don't think it's the same. I don't think it's the same thing.
Why?
Because if you're tired, you're tired and you got to come home from work, and it's a different thing. If you go to the bar and you get smashed, or you're doing drugs, that's intentional. Falling asleep, I mean, that to me, there's no intent there to hurt anybody. There's no intent there. The intent just isn't the same. And so I think personally that might be a hard sell, trying to get that through the legislature. I think that might be difficult.
Let's
But my own
clarify.
personal opinion, that's not Assemblyman Weapons, is I don't think so.
But 1 second, let's
Go ahead.
clarify. I'm talking about if you've gotten less than, let's say, the magic number, 4.5 hours sleep, because you're right, anybody can be tired and something
Right.
can
Let's say
happen.
you did an overnighter card game.
Yeah.
Haven't went to sleep at all. Now you got to drive home
Oh,
3
well,
hours.
Well, what about this? What about you're working, and the next thing you know, the supervisor comes in and says, "Guess what? You're doing another shift."
You're not
Guess what?
going
I
home.
hold that employer now. I feel that we
Oh,
should
so
hold
now
them
you're really getting into it now.
Just
Think,
like
oh,
the
they're gonna love-
bartender, just like
Really?
the bartender that gave him too many drinks when he knows he's going out and driving.
Well,
If an employer is going
that's
to
a
make
very
you work a
good law.
second shift and know that you're driving home and you might cause an accident, guess what? Hold the employer responsible.
Well,
yeah,
okay, that's
That's my opinion.
okay. That's a very good opinion. Now, the next question is, how are you going to turn around and enforce that? The employer is there, and he needs his business to run. It's a pharmacy or whatever it is.
Well, that's even worse. The pharmacist, I own
well,
a
I'm not
pharmacist.
even
You
using
think the
that, but,
pharmacist,
you know,
you think I want my
it's-
pharmacist
Whatever
to
example you're
to-
gonna
Yeah, whatever
give,
example
give
I'm going to
people
give.
medicine and they haven't been
it's the same,
sleeping?
maybe
Listen,
that wasn't the best.
legislatively, things
Sure.
evolve for the right reasons.
Absolutely.
Mets, Yankees, go to a ball game. 7th inning, last call.
Right.
Why? Because we know if you've been drinking and you're overserved, we need to
Right.
give you a little bit of time to get back your reflexes and drive home,
Well,
right?
yeah.
And now on the roadways, the highways, on the sides, there are some groove pavements, so that if you start to swerve,
Excellent.
that's
Right.
to wake you up.
Excellent.
These things
Yeah,
are
great
all
point.
being put in place. Are they enough? No, but there's certainly evidence that we are aware and we're concerned.
What's your opinion, Karen?
Well, I am actually part of an 8-week sleep and stress improvement group. It's a Facebook group, and we are trying to improve our sleep quality and the length of our sleep. And one of the things that we have to do is turn off our computers and our televisions, and so that we don't have what they call the blue light, and turn our alarm clock the other way so nothing is facing us and beeping at us. And it's part of the wellness movement across, really an international wellness movement that is aware that sleep has to do with all of your all your functions, your medical health, and for me, most importantly, weight control.
Sure.
Really? It has to
and
do with weight control.
that your
Absolutely
body,
it does.
uh,
Your
okay.
immune system, your body repairs itself when you're in deep sleep. Very true that things only manifest themselves during sleep. Sitting here alert in the public eye, would any of us start grinding our teeth, snoring, snorting, gasping? But yet we do that during sleep.
Your
And
point
it
is?
doesn't end there. My point is that we are not all that much aware of what goes on during sleep, even to the normal person. You know, the sleeping brain has its own peculiarities, and it's very important to monitor certain people if they've had a few fender benders, if they have chronic lateness, if you've been falling asleep on the job or in the classroom. You know, it starts very early. We have an epidemic of attention deficit hyperactivity disorder, so let's just put them on Ritalin. You have to uncover what's causing that behavior. Could be a sleep disorder, wetting the bed. I mean, over a course of someone's life, there are lots of signals, lots of clues. We have to look at them and address them. So we have to go out to the teachers, the doctors, and just be more vigilant and prepared to deal with it.
Thank you.
So I just want to jump in because I didn't get my chance.
I was going to ask you next.
On the DUI issue. I've been blamed numerous times over my life of being a practical fellow.
Really?
Yes, so I'm going to talk practically speaking. Practically speaking, someone's driving drunk, drugged, whatever it is, there is a test that you can give that person on the spot and say, oh, this person is drunk, this person is drugged, or whatever the case may be. Sleeping, you know, the guy fell asleep, he didn't fall asleep, he made a mistake, I swerved, I could say anything I want. So practically speaking, even if this law was passed, I think it would be pretty difficult to actually enforce, because it's pretty difficult to really ascertain that this person fell asleep because of a sleep deprivation.
Today, it's impossible. What's on the horizon,
And
sir?
that could be.
Well, I wish I had all those answers in my crystal ball. But nonetheless, we talked about texting very briefly. That's difficult to enforce because look to your right, look to your left, everybody's texting. And you feel like, where's a policeman right now? But seriously, sleep deprivation, if it's in the workplace, must be monitored because you can literally, you know, bring on a lawsuit and
And damage
a lot of
someone's life
lives.
forever.
That's right.
But I would like to see it, in the answer of the question, I would like to see it as originally as a healthcare issue, approached as a healthcare issue rather than a punitive legal issue.
Be good
Well,
to
that's a
your
start.
heart.
That's a start.
Be good to your heart, right? If something happens to your heart, whatever the cardiologist says, we're going to do. So I want to address what Caryn said about that support group where you want to be good to your body, get proper rest, reduce your stress. Well, it's called sleep hygiene. And proper sleep hygiene is making your bedroom a conducive environment. Make sure you're not in bed watching television when it's time for sleep. And also checking your emails and doing any kind of work. Your bed should be cool, not hot. And it's only used for two things, sleeping and intimacy, right? You don't want to do too many other things there. And basically, no caffeine, no stimulants, alcohol, no tobacco and smoking after midday so that your body has a chance to calm down. Do not exercise just before going to bed. There's a lot of things that go into proper sleep hygiene that our medical specialists in sleep medicine especially would tell you on a consultation, because people have insomnia as well. It's not just the anatomic problem of sleep apnea. Some people can't fall asleep. Some people do fall asleep but can't maintain it. Every hour they're up, every 2 hours they're up. There are many things we can do. Taking a warm bath, a glass of warm milk, there are all these secret, wonderful little things you can do.
Thank you.
So yes, that's sleep hygiene.
I would like to add in, we talk about texting while you're driving. I deal with a lot of teenagers. They sleep with a phone on. I don't understand it personally.
My daughter hears you loud and clear.
Yes, I'm sure a number of mine do as well.
But Dad, it's my alarm clock. It's all set to wake me up. That's why it's underneath me.
We have a very nice alarm clock that we can do without the phone.
I know.
I'm sorry I'm old school, but there's no question about it. I talk to people like, your phone is going off in the middle of the night and you won't have a good night's sleep. It just doesn't work.
And as a patient advocate, I'll tell you that is something that I prided myself. I never sleep. I leave my phone next to me 24/7. So this initiative is really something different to see how can I, and I have been telling my clients that I'm sorry, you know, during this 8 weeks at least, and possibly more, I won't be answering the phone. I will have someone monitor the messages, but it won't be me.
We
Good for
need
you.
downtime. We're in a society
That's
where we don't have
exactly
downtime.
right.
I couldn't agree more.
That's exactly right.
All the
Definitely.
young teenagers say, of course, this panel is a bunch of old people, you know? We didn't grow up with cell phones.
Speaking of the senior community and sleep, there is a big link, if not links, because let's look at the statistically, 80% of sleeping pills are being prescribed for patients 65 years of age and older. That's very telling. So a lot of seniors are going to their doctor and saying, I'm not sleeping well. I don't wake up feeling too refreshed. What can we do? Here's a prescription. And that's not the only answer. In fact, in many cases, it's the wrong pathway to take. And senior citizens are often seen napping in the afternoon, while we would encourage you not to nap the day we schedule to have a sleep study, because we want to know the real you. So there's a lot of things that have to be educated out there.
Why is it an issue for you if the doctors want to give sleeping pills to seniors who need help sleeping?
Well, once again, we feel that it masks the problem, it doesn't treat the underlying problem, and it can, in some ways, neurologically and from a respiratory drive, suppress your breathing or interfere with your normal sleep cycle and interfere with the chemical receptors that the brain puts out. So you might fall asleep very quickly if you drink a lot. I have had 4 glasses of wine because it was so delicious with dinner, and I fell right asleep. But I didn't sleep as well as I thought I did. And, you know, we won't get into the connection between alcohol and sleep, but again, there are links that lead to these problems down the road. And finally, I'm going to put the link to depression. There's a big link with seniors and depression and sleep and interfering with their mood and their productivity.
Yes.
So it's just education, but it's all out there.
I think we just jumped into one thing. You did ask a question before that I'd like to hear what Al would say on this. We talk about the over 75 population. Should they have to be retested to drive?
Okay, I think what Ellie just asked is, we're on a new topic now.
What's
We're
that?
on the topic of, what about drivers that are impaired because their reflexes have lessened? If that's the right terminology. I'm all for legislation being passed that requires anyone over 75 to get a cognition test and a reflex test. Many states require that. I think California does, for instance, and a few others. Why isn't it so in New York, and why do you react so negatively right
What
away?
exactly
People
are you going to
say
do? Are you
because
going to take the
His cards are
85-year-old?
showing.
I can tell you,
That's because his mom
honestly.
still has a license.
No, my mom doesn't.
His mother-in-law.
Mother-in-law.
I think the courts would never allow it.
Why do they in other states?
I don't know of any state that does it, and I don't know if it's been challenged in the courts. But I can tell you that the senior groups will definitely not like it, and that they vote, and that's going to be a real problem. Legislatively, I think it'd be a problem, and I also think age discrimination comes into that also. I mean, I can tell you, you know, just what are they going to have to do? How are you going to do this? Is it going to be a medical test? Are they actually going to have to take a driving test? Well, they'll take a driving test. You'll have some 25-year-old who's an inspector see some 80-year-old guy get in the car, and he's going to look at him and say, nah, no matter what, he's not getting it.
Wait a second. We're not giving enough credit to people who would be assigned to this, because in the other states, as I said, I think California and a few others have this rule that you have to take a driver's test. I can't say it's for cognition or reflex testing, but there is a driver's test that one has to take when they get over a certain age. Now, the reason I bring this up is because my father-in-law kept getting into fender benders when he was in his late 80s, and I said he's going to kill somebody.
Well,
Do I
agree.
want that on my
No,
conscience?
I
don't.
had an uncle like that who drove like Mr. Magoo, and we sat down as a family and we said, listen,
Take the keys.
the time's up.
But
That's it.
they
That's enough.
won't listen. So I found out
So
that
what are you
there's
That's
going to
true.
do? You're
on
gonna
tell
put
you
him in
what.
jail?
No, I called up his doctor and I said, I'm going to fax you Form D5, or DS-7, thank you, and I'd like you to please fill it out and send it to the state. And so we sent it to the state, and the license was pulled, and guess what? We had to move in with Mom and Dad because all of a sudden they're isolated
Be careful
now.
what you ask for.
They're isolated, and that's part of why I'm living here on Staten
So-
Island for 5 years now.
I'll
And-
tell you a
and if I
nice
could-
story. I'm sorry, Caryn. I used to work with a fellow in the nursing home when I worked years back in the nursing home. He's an older gentleman, unfortunately no longer here. He used to get into an accident every other day, coming to the nursing home. Everyone else is moving in his lanes, and the way he figured out how you deal with this is every time he smacked up a car, one of his grandchildren got the car. So they never wanted to take his keys away.
There you go.
So then she said, that's enough. Okay, that's
Yeah.
great. Well, panelists, we're just about out of time. Is there anything that we haven't touched upon with respect to legalities and seniors and health issues that you think is important?
Can I just say, we do have on our sunadvocacy.org website, you can download how to tell your elder it's time to stop driving, or for someone to tips on when you can recognize yourself that you should stop driving. We have many other resources there free to download, so please visit our website, sunadvocacy.org.
Excellent. Anthony, any closing statements?
No closing statement at all. Just thank you very much, Angela, for inviting me here today. It's been a great panel and a wonderful discussion.
You've been a pleasure. I want you both to come back, and you are a wealth of information. This lady knows about everything. I love it. Any thoughts?
And this, I can't wait to get in my car and stay away.
Al, any closing thoughts?
Yes, I'd like to say that we all want to be the best version of ourselves, so to be the best you can be, take care of yourself, get good sleep, and if you're not really feeling the way you wish you felt, don't accept the fact, I'm getting older, it's to be expected, have yourself screened, and if your doctor of 35 years has never once asked you, how's the quality of your sleep? You better find someone who cares. Bye-bye.
That's great.
Thanks for that.
Thank you for watching. We air on Tuesday nights in Staten Island at 8 p.m. on Channel 34, and we also air in the other boroughs. You can find us on YouTube as well. Thanks for watching. Bye-bye.
Thanks.